Now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Thank you for joining us today on our webinar, My Patient Rights, Removing Barriers in Treatment and Care. So I'm Pip Marks. I'm the Project Director for Family Voices of California, and I will be hosting our webinar today. So before I introduce our wonderful speaker, Liz Helms, I'd like to tell you a little bit about what Family Voices of California is about. We're a statewide coalition of locally based parent-run centers working to ensure children and youth with special health care needs receive quality care. And as the state affiliate of the National Family Voices, we are California's federally funded family-to-family health information center, and we provide statewide support and resources to families of children with special needs. Our webinars serve as statewide trainings, and actually in this case it's a nationwide training on various health topics, especially specifically usually around children and youth, and are geared towards families, professionals, and parent-to-parent resource staff and advocates. So a little bit about the platform we're using. If you have any technical difficulties, you can call the GoToWebinar directly on the number on the screen. And due to feedback issues, we have everybody on mute from our end. Throughout the webinar, feel free to type your questions in the question pane on the right side of your menu. We'll stop periodically to address questions as they come up and also save time at the end for additional questions. Today's presentation is being recorded and will be posted on our Family Voices of California website along with the PowerPoint slides probably by tomorrow. And afterwards, after the webinar, you're going to be emailed a very short evaluation survey, and we really appreciate you responding to the survey. It gives us invaluable feedback. So it is now my pleasure to introduce today's speaker, Liz Helms. Liz has been a leader within the patients' rights movement since her recovery from TMJ disorder in the mid-1990s. Liz's vision, breadth of knowledge, and unwavering commitment to coalition building, grassroots advocacy, strategic planning, and policy development have earned her immense recognition and respect throughout California and nationally. Liz has helped shepherd many broad-based, first-of-its-kind patient right laws in California. She is currently the President CEO of the California Chronic Care Coalition, which is an alliance of a nonprofit, social consumer, and provider organizations united to improve the health of Californians with chronic conditions and diseases. Liz co-founded the Chronic Care Policy Alliance, working across state lines to ensure access to affordable, quality health care, giving states a broader voice and advocates for the enforcement of anti-discrimination laws in the ACA. So thank you, Liz, for joining us today. Oh, and actually I uploaded, there's a handout of Liz's full bio, so you can learn more about the amazing works that she's doing. So Liz, thank you very much for joining us. I am going to pass the presenter role over to you.
Thank you so much. I really appreciate it. And hello, everyone. I'm so happy to be here today to talk about a subject that I know all of you are very concerned about, and that's getting the right access to care at the right time. And before I start, I wanted to just keep in our thoughts all the families that are going through very difficult times with the fires that are taking place in the state of California, in fact, all over the state of California. We're in the Sacramento area, and we're heavily smoked in from the Paradise fires, but we also know the LA basin and now San Bernardino fires are going pretty good. So please be careful when you're outside and be sure to take precautions so you don't have problems with your breathing, and keep everyone in your thoughts as they go through this horrific ordeal. With that being said, I really appreciate Family Voices for inviting me to come here today to talk to you about my patient rights and the work that we've been doing within the California Chronic Care Coalition. We started the coalition about 12 years ago, and then a few years ago, with the Department of Managed Health Care having their HMO helpline, we decided that we wanted to do a little more to help them get the word out that they actually exist and that there's a place for people to go when you need help. So that was the impetus of starting My Patient Rights. It is a one-stop shop for patients to file complaints with their health plans and state regulators to access the care that you need. It could be for people who experience denials to important procedures, barriers to prescription medicines, out-of-pocket network provider bills, delays in receiving tests for chronic conditions and diseases, denials to specialists, billing issues, a host of different issues that you can file a complaint. And then we also do say, go to your health plan first, and I'll get into that a little bit more as we move forward. One thing I don't hear often when we go out and talk to people out in the community is that they know they even have rights, or that they know that there's a regulator that they can turn to if they've been denied care, or they don't understand their treatment options or are subject to their health plan's barriers to care. So it's really important when you're choosing a health plan, and especially now while we're in open enrollment, that you choose wisely and find a plan that is going to really fit your needs. We have on the website the summary of some of the topics that you might be hearing about and might not know about. So we wanted to do a short summary about what those words mean when you see them at like adverse tiering or coinsurance or high deductible plans or non-medical switching or out-of-network charges, a host of different issues that might come up that we wanted to be sure that you have a better understanding of what those mean. And I'm going to take you to the live website in a minute and show you some of the ways that you can navigate through the site itself. Getting help. So what do? So when we started My Patient Rights, it started in the state of California. We had such great response that we moved it into 17 other states last year. And as we're finishing up this year, we are moving to take My Patient Rights into all 50 states. So as you look at this map, what's in green right now are the states that are live, that if you click on the state you want to know if you have family members, or you could go to the site. These are the states right now that are live that give you the information that you need. However, early next year, all of these states, all 50 states, will be live with the information that will really help you navigate the issues across the country where you might have other family members or people that have questions. We're really excited to be able to do that. So let's talk about filing a complaint. After clicking on California via the interactive map or the drop-down menu, patients are given a step-by-step guide on how to file a complaint with your health plan and how to utilize the California Department of Managed Healthcare or the Department of Insurance. It links you to complaint forms of the top health plans. So the health plans in California are also listed with live links that go to them. And then the contact information and links to the complaint forms for the Department of Managed Healthcare and the Department of Insurance. A link to My Patient Rights contact form is also is listed in there, but it's not, you have to go to share your story, and then you can also share a story, and I'll talk about that in just a minute. I also want to talk to you about when you file a complaint. I think one of the fears people have if they come forward and say, I'm not getting the care that I need and I've been denied care, if I file a complaint, I'm going to go on a special list, or my health plan is going to be mad at me or whatever, and I want you to remove that from your thoughts. You do not get put on a special list. What you do get is the help that you need. And we just finished a report that we did over the summer on independent medical reviews, where over 60% of the complaints that are filed and asked for an independent medical review, over 60% of those are overturned and people are able to get the help that they need. We want to keep you informed, keep you up to date on current events, and hear other journeys that people report to on the blog. And we've also done some really great videos. We have a new video that'll be coming out pretty soon that really talks about my patient rights and highlights 3 patient stories on that. And then we're also doing another, like an explainer video that'll also be launched next year that'll give you a step-by-step on how to use this site. So we're really, really excited about that. The other areas that we really work hard to get information out to the public is through our social media channels, our blogs, and our Facebook pages. And so we want to be sure that you understand that there's a lot of tools around that you can use to get the information that you need. So here's the Share Your Story page. And I can't explain what that means for our legislators, our policymakers, for yourself to be able to share your story and hear from other people that might have similar instances of things that have happened to them. And one of the things that really can be amplified is for you to come forward and speak publicly about things that have happened to you. It helps us a lot. It helps the Department of Managed Healthcare and the Department of Insurance understand trends that are happening in the system so they can help allow you to let your voice be heard and you know, where to go and what to do for it. And I think we had a question coming, and I'll be getting to questions in just a minute. When we have people that have come forward, you have on the website, you have the opportunity to keep your story confidential or to allow your story to go public. For many of the people that have come forward, they want the word to get out, and they actually have gotten more involved in the work that we do, and that's totally up to them. I know when you're sick or you've been denied care, what you need is to get the help you need and to get the care that you need, and you need to get it now. Don't want to wait 3 months, 6 months, a year from now. You want to get it now, and that's where you need to keep your focus. But we also like to hear about what is happening so we can help on our end of it. Once we know that there are things that are happening to people, we can see if there's multiple stories coming in that are very similar and look at plans that this is happening, where it's happening, what plan is doing what. And that, I can't tell you how much that, how important that is for all of us to have a better idea of that. Not only that, it empowers you to be able to get the help that you need and get it faster. And also understanding how important your voice is, how important your voice is to policymakers. Once we go into a legislative session and we see a trend and we say, okay, we need to go in here and we need to fix this, how do we do that? The first thing legislators ask us is, do you have a patient story? Do you have someone that could come forward and share their story? Because that puts life into it's really happening to someone. And we've actually had to pull a legislative bill out because we knew it was going on, but we hadn't identified the patient or the person that needed to come forward to share their story. So I can't stress this enough. I'm going to go to the website, and while we're changing over that to the website, I'd like to answer a question. Why and when should I file a complaint? And how HMOs are regulated, what's the history? So thank you for this question. Why would you file a complaint? You would file a complaint, and I can't stress this enough either. If you're talking to a health plan and you're explaining to them that you need to get the care and they've said, no, you've been denied care, you really want to try to get that in writing. because that will help you build a paper trail. And a paper trail is really important. When to file a complaint, you've been denied access to care, file a complaint with your health plan right away. Don't wait, because time is of the essence when you are trying to get the help that you need. Filing a complaint with the Department of Health Care can take place if you've gone back to your health plan, you've asked them to review it again, they come back with another denial, then you can file a complaint with the Department of Health Care. You can file a complaint with the department at any time, but it's always best to try to go back to your health plan first. And that also builds your paper trail. And how much are HMOs regulated? The Department of Health Care came into effect in the late 90s, and we worked really hard to build a separate place out of, it was then housed with business transportation and housing, and we just didn't feel that was the right place to put it in under the Department of Corporations. So hence came the Department of Managed Healthcare. And we've had amazing management of that department who have been very focused on patients getting the right care and have actually fined health plans when they find wrongdoing or find large numbers of wrongdoing. They will go forward and file levy, dollars on them that they have to pay. So they are an amazing resource, and just not enough people know that they're there. So their function is multifunctions. They are the regulators. So under the law of NOx-Keene, so NOx-Keene is what regulates the Department of Managed Healthcare under the HMOs and some of the PPOs and some of the Medi-Cal plans. But Medi-Cal is also under the Department of Healthcare Services. And our system is a little complex because we also have the Department of Insurance. What we've been asked is for everybody to come through the portal to the Department of Healthcare, and then they can route it to the right place to go. So you can get to the place that you go. And at that time, they're collecting the data. They're seeing who's calling in, what are the problems, what are the issues, and that information goes then to the Office of the Patient Advocate. The Office of the Patient Advocate used to be actually a real Office of the Patient Advocate where you could go to get help. That's moved over into the HMO helpline through the Department of Healthcare, but at the same time, the Office of the Patient Advocate is now working on gathering that information, and they have a report card that comes out that stars the plans on how well they behave and how well they provide care. And that report card was just released, so that you can find on our website, and you will find it on the My Patient Rights website fairly soon. So I've got the website up right now, and I want to just scroll down to show you some. So this is like the front page, and then you can scroll down, or you can go to some of these toggle switches up here at the top where you can just press them and it'll take you to the page. But here's the file a complaint. I wanted for you to see this live so you have a better idea. So here's the state. So let's say we want to see, here's California. We want to pull California up. So we're going to go, I'm going to click on California, and now it's going to bring up California. So you're going to see step 1, notify your health plan, as I've said, and then it will show you the different health plans that are in the state and kind of walk you through what you need to do. So all of these links are live, and they'll take you to that health plan. Also, here's the facts of commonly asked questions. So here's what is My Patient Rights? Who are we? Well, how did we come together? And it just enhances what I've already talked to you about. If you're denied access to care or for different services. And then why did the California Chronic Care Coalition want to provide this service? We felt this was so important to help support consumers in the state that need health care, especially people with chronic conditions and disabilities, and also let them know that there is a place to go. I know when I started as a patient getting denied care, and that's what brought me into patient advocacy in the early 90s. I was denied access to care, and I got really angry about it. And I realized probably I wasn't the only one that was having those problems. There wasn't really a place to go. There wasn't an organization. My case was under temporomandibular joint, TMJ. There was no TMJ organization. There was nothing on the books to provide care that was in NOx-teen. And so that's where I entered and just got active. And that was back in like 1993. So it's been quite some time. It was life-changing for me, and I've stayed in advocacy since that time. That's why I can say to you from firsthand, your voice is really, really important. So here's another, let's click on this link and say, why should I share my story? Well, by sharing your story or that of a loved one, you help us highlight reoccurring healthcare barriers that place other patients like you at risk. You'll bring awareness to your particular problems so other patients won't have to suffer from the same denials, delays, and anxiety that you have. So it's really important. And of course, the first and foremost is getting you the care that you need. So don't hesitate in filing a complaint and getting that in. Let me click on this link. Will my patient rights help me resolve my complaint or grievance? Well, due to healthcare confidentially, own your health insurance plan, medical group, doctor, or the appropriate contact at the state regulatory agency can assist you in resolving a complaint or grievance. However, we do provide you with the information you need to contact those people or those agencies that can help you. Now, from time to time, when someone has been in dire straits and they call and say, I need help, I have, or our volunteers have, helped people talk them through things. But primarily, we want you to utilize the agencies that are available to you. They are no cost to you, and get the help you need, and let us look at what's happening and try to get to the place that you need to be. So let's talk about some health plan barriers. So let me scroll down here. So here's where we had shown that slide that had adverse tiering, co-insurance, high deductibles, out of network. Let's go to prior authorization. So when a health plan requires patients or their doctors to get approval from the health plan before treatment begins or before they can see a specialist, prior authorization often delays care for patients. But I also want you to know that we have worked to streamline the prior authorization process, and we have a form now that should be universal. We hear plans are still not using them universally, so we want to hear about that. But we want for you to know that there is a time limit, and that don't sit at home and say, and I've been denied my medicine, or my doctor can't help me, or whatever. There is help for you, and there are regulations that can help you get to where you need to go to get the medicines that you need. Now, step therapy, for a lot of people that have chronic conditions or multiple chronic conditions, this is the one we hate. One of the things we hate the most is step therapy. It's a fail first policy that occurs when health plans deny patients the medication their doctor has prescribed, or tell them they have to try another medication first that is usually cheaper and less effective and has been used to treat the patient's condition and failed. You have to fail on that. So that could be 30 days. It could be for any amount of time that you're required. We have streamlined that. A lot of states are looking at the work we've done in California, and I'm really proud of our group and all of our members that have worked so hard to ensure that there is a speedy resolution when you are asked to fail first on your medicine. So here's a lot of really good information. Click on that, go in here and look at what you need and find out what these terms mean so you're armed. The more you're armed with information, the better you're going to be when you go to fight for your care or file a complaint to get your care. So I think we can go. I know what I want to do. I want to go to share your story so you can see what this looks like. So this is real. We've tried to make this really simple. So here's the form. So you put your name in. Here's some stories about other people that have had success and have come forward and shared their stories. So you put your name in, the state that you're from. So if you're California, you do California. And then what's your health plan? And then please indicate if there's been any action taken. I notified my health plan. I notified my health plan and filed a complaint with my state agency. And then here's your story. Now, if you scroll down a little bit more, here's where we're very respectful to your privacy. So we ask you, can we share your story publicly? You can say yes, or you could say no. And you can also say, no, but please, I want someone from My Patient Rights to contact me, and we will get in touch with you. And then you just submit it. It's just real simple. And then we get that information. And you can put your information here. You could just put your email in. It's just whatever level of information you want to give us is fine. But we always are hopeful that people will share their stories and come forward because it's so important. So I'm going to go out of the website, and if you have any questions, please be sure to put them in the chat box.
Actually, Liz, this is Pip. There is a question. Do you have a moment?
Sure.
To answer, someone was asking about, when you talk about, you had the list of health plans, does that include the county health organization plans, the Medicare managed care plans?
Those are, I don't believe that those are all listed, but those are listed at the Department of Healthcare Services, and they are the oversight to the Medicare health plans. And here's something very interesting. When Secretary Dooley, before she left there, we had quite a discussion with her chief of staff on letting them know when someone really needed help. They are really trying, especially people that are in covered California, and things change for people. They may become ill and go on disability and end up on Medi-Cal, but they may end up going back to work, and now their work's going to pick up their insurance, or they're going to apply for insurance through Covered California. So they're going back and forth between these plans and between these agencies. So you want to be sure that the Department of Healthcare Services will also hear about your request. And if you have a specific plan, that when you file your complaint with the Department of Managed Healthcare, you can state who that plan is and if it's with Medi-Cal. And then they will help you facilitate to where you need to go.
Great, thank you for answering that.
Okay, so we're going to go back to our Share the Story, and now we're going to go to a toolkit. So we have an amazing toolkit that is available for organizations, for consumers, that will help impact you by educating you and activating and mobilizing people like you. And like I said, legislators and policymakers need to hear our stories. We need to share your stories, to share with them, to help them. They are so willing to do the work they need to do and go and fight for consumer protections, but they need to know that there's a problem. And that's actually how I got legislation for TMJ through, is that I had come forward because sometimes when physicians and medical groups go forward to talk about an issue that they know needs to be changed, or a policy that needs to be changed, sometimes when they go in there on their own, it looks self-serving and they don't always get the result that they want. But when they bring a patient in or consumer in to tell their story, that can absolutely make the difference. So I can't state that enough, and I'm sorry that I'm repeating that so much, but it's very, very important. So this particular toolkit provides you with the following. It has social media content. It has blog or newsletter contact that you can use. It helps you understand what we're tweeting. We want you to go to our Twitter page and our Twitter feeds and share them. Just put them back out on your site. So, and we also know how big that is and how big it's going, where it's all going. And then I think what I really want to also stress is you're looking at the My Patient Rights badge. We'd love for you to add that to your website with the link that goes straight to this website. The more people have, the more information people have, and the more they know to make it easy for them to find who we are. So let's say Family Voices says, okay, we're going to put this badge up on our website to make it really easy for people. When you're on their website, you're going to see that. And then all you have to do is click on it, and it'll take you to the My Patient Rights website. So that's also important. We're trying to get that in all of our groups across the country and on everybody's website and on their Facebook pages, wherever they're social, wherever there's an opportunity for this to be utilized, even on resource pages. We try to put it everywhere. So we try to make it as easy as possible to for people to find it. I also want to also call your attention. It's the word patient does not have an S after it. The S is after rights, so it's My Patient Rights. I know when we first did this, I wanted to do My Patient's Rights, but it's actually My Patient Rights, so it's singular. So I just want to call your attention because that we've heard a lot of feedback from people that you know that they automatically put an S and we can't find your website. We want you to be sure that you can find the website, and just remember that it is singular and the S is after right. Here's another, and I want to end this fairly soon so we can open this up for questions, but I want to also let you know, so this is one, this is Keisha Ford, and she came forward with a problem that she was having, and we went to work with Keisha on trying to get her the care that she needed. She needed urgent care, and she'd been denied and denied and denied. And she had worked, and she was one of those that had to go from, she had to quit her job or she had to go out on disability, and she didn't know when she was going to go back. And she was actually working in the entertainment industry at that time. And she had to go on Medi-Cal. And so she had to change her plan. She had to change her doctors. She had lots of barriers to care, but she didn't know where to go. She didn't know what to do. So we went to her home and we videoed her. And her story has been extremely impactful for others to say, oh yeah, that happened to me, or thank you, Keisha, for coming forward. Excuse me, I just make a drink. The other thing that happened with Keisha, she didn't realize that her health plan, HealthNet, would have assigned her a social worker, and that social worker would have helped her. I actually called the health plan on her behalf with her standing there giving me permission to do so, and we got HealthNet to activate and really get involved with her case, and HealthNet helped her find a doctor. And then other things happened to her, and there were lots of other changes. So this is one of the ways that we can help people, and her story has gone everywhere. So right now, her story resides in two places. It resides on the California Chronic Care website, which is www.californiachroniccare.org. And on the front page, you just can go and scroll down. You'll see a video there, and then it'll say click on more. and also on our Facebook page at CA Chronic Care. Some of the things that we did this year that really made a difference is we got our policymakers involved in our website, and they were tweeting out tweets that they were sharing tweets from us, and they were putting these videos up on their website. And then we asked them, while we had a piece of legislation going through, if they would mind coming forward and talking to people via our Chronic Care Coalition videos. So we've put this under It's My Story, and we did that so there's no spin to the story. The story's just there. It's the real person's story, and we don't have anybody changing it to where it doesn't look or resemble, or there's a 30-second soundbite from it. So they said yes. So you will also see on both our Facebook page and on our website these videos. So I would say take time to go there and look at these stories and see how well they're done, and then that might also help you say, okay, you know what, I'd like to do that. I'm going to come forward and I'm going to contact the coalition, or I'm going to contact My Patient Rights and say, yes, I have a story and I would like to share it. So I'd like to open this up for questions. Pippa, do you have any more questions that people would like to ask?
Yes, there are a couple, Liz. One attendee's asking about a question specific to ABA, behavioral health therapy for children without an ASD diagnosis. She said that she's heard that Medicare now, as of July 2018, needs to cover it if certain other things are in place, but she is not able to find any documentation. Are you able to help with that question?
Yeah, I'd say let us do some research on that. If you could send that over to us.
Okay.
And we will dig into that and find more information. If their behavioral health is another whole world that we really need to focus on, because so many people have behavioral issues, and also their health impacts behavioral health. So it's a two-way. You know, we want to really do more in that world where we're really working closely with the mental health organizations and behavioral health organizations to understand that we have a whole body and things happen within our whole body, and we need to be able to have the resources to find ways for them to get the help that they need. But for this particular question, we will dig into that and get the answers and get that back.
Great. And another question about, they say, I called the Ombudsman person for the Department of Managed Healthcare, but my question was really a Medi-Cal question. The Ombudsman person said they couldn't help me. Do you have thoughts on Medi-Cal Ombudsman service?
Yeah, that's, again, Medi-Cal services are done at the Department of Healthcare Services. However, you should have gotten more help when you called that helpline. And that's the kind of information we need. And that's the kind of information we can feed back to the Department of Healthcare Services, that people need help and they're not getting it. So that's something that we could look into to get fixed. And that's when we know things are working or they're not working. What we think should be working, that may not be working. We have no idea unless somebody says, I tried this and it didn't work for me. So thank you so much for bringing that forward. I have another question that just came in that says, will my health plan know that I filed a complaint, and will they use that against me? So I think I talked a little bit about this in the beginning. Now, if you file a complaint with the Department of Managed Healthcare and they go on your behalf, the health plan will know that you filed a complaint. But if nothing happens, they won't. And what's also interesting, as we did this research on the independent medical reviews and how they were overturned, the health plans were not named. The only way the health plans were named, and the person is never named. The person is they keep the privacy of that person, no matter if it was overturned or it wasn't overturned. If they uphold or they don't uphold, your name is never posted on the Department of Managed Healthcare website. So nobody's going to come back at you. However, if someone does come back at you, that's pertinent information that we need to know right away, because that should never happen, ever. And we can jump on that quickly.
Okay, thank you. A couple more questions. If you are a child, youth, special health care needs, and you have insurance under one of the county organised health systems, would you contact to file a complaint after addressing the system, the managed care plan? Who would you contact after you filed a complaint?
Well, first, if you filed a complaint, you should hear back from them. If you don't hear back from them, call them one time, say, I filed a complaint, where is it in process? When will I hear back? And if you're not satisfied, that's when you go to the agency. Just go right on to the agency. And don't worry. The thing that I really think is important is no one is going to help you if they don't know you need help. So when you need help, call out for it. And if you're not happy with what you're getting from the plan, go higher. Go higher. My Patient Rights is here to help you. And for whoever had just asked that question about Medi-Cal, it would be great if you could send us an email and share that with us, so we're actually going to have a meeting on Friday with the agency. So that would be really good feedback. So if you could hopefully do that today, that is something we can present to the department right away to let them know that there might have been a glitch in the system, or there may need to be more educating that they need to do for people from all the different plans that fall under different regulators.
Thank you, Liz. And we have a question from Nikki. I believe Nikki's in Colorado and works at a family resource center. She asks, what if you've been denied 2 to 3 times? This is on behalf of someone who came into their resource center. What if you have been denied 2 to 3 times nursing care for your child, then after flying to Denver to appeal the denial, they approved nursing? 4 weeks later, they said it was approved, but they lowered the daily limit to 4 hours a day. And your child's already met the limit, so no more hours left for the child. There's no more funding. In a situation like that, what would you recommend?
And they've worked with the health plan, or they've worked with the regulator or the county. I know it drives us all crazy. You have to go back and look at what your plan covers. So in your evidence of coverage, it might state that you will get X amount of treatments or X amount of visits. And if you need to go over that, you need to work with your doctor to get an exception. But if you're constantly being denied care, again, for the person that called in from Colorado, go to the Colorado site that we have and look up the different agencies that are there, the different plans that are there, and see what they're saying. But I would say go back to your evidence of coverage. Make sure you have coverage for that. And if you don't have coverage for that, it's going to be a tougher fight, but that doesn't mean you won't win it.
Actually, I'm sorry. She just sent another message. The family lives in California, but they flew to Denver to appeal.
Oh my gosh, they had to go to Denver. So the plan resides in Denver, and they went to Denver to appeal it, but they live in California.
Yep, that's right.
That's really bothersome to me. They shouldn't have had to do that. That's the thing that worries me about health plans residing in different states. All plans that that provides services in the state of California have to abide by the rules of the state of California, or they don't get licensed here. That's how it is so far. As far as I know, that hasn't changed. So that might give you a little more ammunition, but I would love to talk to that person in person and get more of the story.
Okay, what I'll do is I'll email the, no, she said wonderful. I'll email our attendees and ask if it's okay if I share their emails with you if they've got further questions. Or they,
okay.
or I'll send them all your email address or the contact.
Sure, absolutely. Sure, absolutely.
One more question, Liz. What happens if you've been told by a doctor's office that they no longer want to see your family? Can I file a complaint with the plan for that, or do I just have to find a new doctor?
Yeah, that's what we call doctor firing your patient. And believe me, excuse me, it's happened more than you think. Doctors are under a lot of pressure right now. My voice just went away. Excuse me. There's really no excuse for a doctor to do that, as long as the person is not rude or making threats or trying to. Hang on one second. See if that helps. Okay, got a little bit of water. This fire, the smoke that's here is affecting all of us. Excuse me, different ways. Okay, doctor firing. Love to get that story. Like I said, there's been a lot of people. In fact, I was fired from my doctor when I had TMJ, and he said to me, "You've got to go someplace else. I can't help you. The best help you're going to get is if you go to such and such." And he did that actually to help me. But and of course, that was so frightening to me because he had been my doctor for a long time. And this was back, if you think about it, this was back in 1993. So that was, that just was shocking to me. But for doctors that are doing it right now, and when I talk to some of the physicians, you know, their reimbursement rates are so bad and so low that we really need to help them get to a place where they can really manage their practices better. But I don't, the question I would ask a doctor that says, "Hey, I don't want to see you anymore," is like, is it why? Is it because you don't feel you can help me? You don't understand my problem? What would you recommend? And like I said, if you haven't been rude, if you haven't threatened them, if you haven't, you know, there's really, they should be very honest with you. And maybe it's just they don't understand the issue and they're saying go somewhere else. But if they just say, "No, I'm not going to take care of you anymore," that's kind of, that's a real low blow, and that shouldn't happen.
I'm not seeing any more questions coming in. Let's just give folks a few more seconds. Corey, who's an attendee, answered. She also said regarding the question about ABA coverage for non-ASD children, she said if the person is a regional centre client, then they can contact their service coordinator. Otherwise, if information is still needed, to contact her, and I will share that email address. I happen to know that the person asking that question is from San Diego, so that's going to be very helpful for her. Not seeing any more questions coming in.
And if there's any questions that we've missed or that come to mind later, just go to the site and send it to My Patient Rights. We'll get it, or send it to My Family Voices, and they'll get it, and they can forward them on to us. So we can coordinate that.
Okay. Oh, Liz, just after you talked about the doctor firing, an attendee is asking, who would you file a complaint with when this is happening?
Just go to the regulator as anything else. Okay. Just go to whoever is regulating. Now, here's another little glitch to the system. So health plans are regulated by the Department of Managed Healthcare. Medical groups are not. So medical groups are under contract with the health plan. So the first place I would definitely go is back to member services at the health plan and ask them for help and ask them for advice and work with them.
Thank you, Liz. Oops, sounds like you've got calls coming in. I think that is all the questions for now. So just so people know that if they have further questions, they can get in touch with Liz on the website that she was giving out, or they can email me and I'll pass them on. So, Liz, thank you so much, and to all of you for joining us today. I just want to remind you to take the short evaluation survey. That's really helpful for us. And I wish you all a great day. Thank you. Bye-bye.
Thank you.